Hello, everyone. Welcome to this first episode of SEMA Budget Podcast. And this is a platform where we will be discussing everything and anything budgets. On set today, I am joined by two amazing gentlemen. We will be getting to introduce them and then we will delve right into the topic. So we will start with John and then we come to Kip.
Nice. Thank you, Irene, and thanks for having us. My name is John Kinuthia. I'm a Senior Program Officer with the International Budget Partnership Kenya, and it's nice to be here for our first podcast.
Asante sana, John.
Thank you, Irene. My name is Kipkorir Piakon, and I'm the Assistant Programs Officer, Research and Analysis. And welcome to our podcast. To you. Thank you.
For the benefit of the people who are getting to hear us for the first time, I think it will be nice if we tell them what we do at International Budget Partnership. So, John, will you kindly take a minute or two just to introduce what we do at International Budget Partnership and why budgets are so centered to our work?
Thanks, Irene. I think for us at IBP, we have a very simple belief, which is that the best auditor of what government does with our money is an informed citizen. And so for us, all our efforts are geared towards building the capacity of citizens in whatever forms they are organized, whether they are in civil society organizations, NGOs, media, or whatever other formations they might be in, to be able to understand budget processes and how they can use them to make sure that governments are more responsive to the needs of the community. So that is a very central tenet to the work that we do.
And that's IBP. And one thing about this podcast, you name it. If it's anything that is in the budget calendar, we will be discussing it. If it's anything that is core to any mandate that we have, we will be getting on this set and we will be discussing everything regarding budgets. So for this particular episode, we are discussing about transparency, accountability, and some of the opportunities and gaps that the NHIF can leverage on. So there's a research that was conducted at International Budget Partnership that we'll be getting to unpack in this particular episode. So just to introduce and ask the first question, most people have interacted with NHIF. May it be at the point where people pay premiums to the NHIF or at a point where government comes in and just to cushion vulnerable families where they get to pay their NHIF. So maybe at the core of the conversation, people would wonder, why is the NHIF so important to us?
Thanks. I think it's true. NHIF is a household name for many reasons. Some good, some not so good. But I think all of us as Kenyans are aware of the role that NHIF plays when it comes to our healthcare. And so that's even part of the reason why, we thought it was good to do some analysis from a budget perspective of NHIF. But I think just to introduce it, I think for the last 5 years, one of the things that has been a very common name is the Big Four. And in the conversation around the Big Four, universal health coverage is one area that the government has been very keen on. The previous government was pushing big around this. And NHIF is right at the center of making sure that the universal health coverage is realized as an objective of government. And, the universal health coverage is basically an effort to make sure that every Kenyan can access, healthcare at an affordable cost. It's accessible, of course, and that the quality is good. So that the healthcare that is provided in Mandera is of the same quality as what is provided, to somebody in Nairobi. And NHIF has come into that conversation very strongly of late because the government is planning to increase the amount of resources that go into healthcare, but through NHIF as an insurance scheme. So that first big policy objective that the government has around universal health coverage places a lot of weight and importance on NHIF. So understanding the kind of monies that NHIF is collecting and how it's spending those resources then becomes a very important thing for us to do as citizens from an oversight point of view. I think that's the first one. The second one is, if you look at NHIF's collection of the money they get from us, either what we pay for those who are employed, but also those who are in the informal sector also do contribute the 500 shillings per month. Since 2016, 2017 to 2020, 2021, the revenue that NHIF generates, I don't know that generate is the right word, they collect because they don't do business, pick it from us, grew by 73%. It almost doubled, right? And if you go back to when the previous government came in 2013, 2014, up to 2020, 2021, the revenue that NHIF is collecting now almost grew 5 times. So that's a very significant growth in the amount of money that NHIF is collecting. And that's a big reason why we have to pay more attention to what NHIF is doing. And they have to be open with what they are doing with that money, where they are collecting it from and the likes. But even the membership of NHIF has also grown significantly. In the same period, 2016, 2017 to 2020, 2021, the membership grew by 51%. So, even from that direction, you can see that NHIF is becoming a bigger player in terms of the resources that it's collecting, but also with the membership that it's covering. So now NHIF has a principal membership of over 10 million people. So that's quite significant when you think about our adult population. The very last thing which I think is important on why we have to pay more attention to NHIF is the fact that we live in a poor country. I think it's important for us to keep recognizing that. Sometimes the glitter of Nairobi might make people think Kenya is a very rich country, but we still have very high, poverty rates in the country. And so this whole universal health coverage conversation means that there are people who will not be able to pay the 500 shillings. As much as we've made in the law now that it's mandatory to be a member of NHIF, people can register. But there are families that will not have the 500 shillings to pay. And what the government has done, it has started a program where the government itself will directly be paying the 500 shillings for those poor households. And the target is to get to cover about 5 million people, right? That's significant when you think 500 per household and you have to cover that huge number of households. So the fact now that there will be direct taxpayers' money that will be going to NHIF to be able to cover for those poor households is another reason why we have to be more vigilant. And so this whole conversation for us doing this research with KIP was basically to try and see, can we get a clear picture from NHIF on how much money is being collected? Of course, we know it's bigger now. Who is it being collected from? How many people are covered? In what cadres of life are these people? How many are employed? How many are in the informal? How many are, the poor households that the government is covering and the like? So the transparency part of NHIF is very important. And remember, NHIF is a parastatal. And a huge part of our government budget is spent through parastatal. So from all those angles, you can see the importance of why we have to be a bit more keen on what is happening within NHIF.
Thanks, John. Having unpacked what NHIF entails and why this study was important to us, Kip, there are people that we worked with in the course of this research. So maybe just to shed some light, who did we work with in this particular research?
Thank you, Irene. So while we were doing this research, so the research first is we call it opportunities and gaps in NHIF, just in accountability and transparency. And the people that we work with are budget facilitators who are at the county level. Also, the government institutions that also have been mandated to do this role. And the first, how we did this research, so we had to come up with some questions that government are required to provide such information that we were going for. And in doing so, the first place that we started with was first ensuring that what is required as per the law. And we have a lot of, it's required that they provide some certain information and in their publicly available platforms. For example, NHIF is required to publish their annual reports, also financial statements, which that was the first place where we went for so that people can be able to access such information. After doing that, where we didn't find such information, we have to also use the Access to Information Act, which in the Access to Information Act 2016 requires that also where such information is not available and the public are able to request, they should be able to get such information. And doing so we also did requests to the government entities that also are required to provide such information, both at the county levels that we had selected. They were 5, and I can mention those ones, which was Nyeri. We also have Machakos, we have Kilifi, we have Busia and Baringo County. Those were the lower level or the counties that we had selected so that we do our research. But our research also was more focused at the national level, meaning that we were focusing on the NHIF itself. And also, but government cannot work or cannot perform alone. There are other MDS or ministry department agencies that are also supporting one another. And one of those, or some of those ones, were Ministry of Health. We also have the Parliament, which is the National Assembly. We also have the National Treasury, and we also did access to information on those ones as the second step for our study. And also to mention also in the counties, so we also know counties also are facilities, or the health facilities which are under counties are also directly funded by NHIF through some, for example, Linda Mama. We also have Edwafia, which NHIF directly pays them or purchase their services, but those are under the county level, and that's why also counties were very important in that essence. And the last step that we also pursue was where also the access to information were not, or we didn't get information through access to information, we had to do the key informant interviews. And in doing the key informant interviews, we have to request. So we did key informant interviews to the National Health Insurance Fund. We also did to Minister of Health and National Treasury and Parliament, and we followed up. So getting that such information also was not easy, as we'll explain later. Then also at the county level, our partners were able to do the same. So requesting their counties so that they could be given an opportunity to conduct interviews and find what are the challenges that affecting NHIF. Thank you, Irene.
So we have done a desktop review to find some of the information that NHIF has done. We've also made the information to access request to some of the agencies that are mandated. And where we could not find either of these two, we requested key informant interview. What did we find out?
Well, so that's an interesting question because Kip already gave a bit away of the challenges. I think the first thing which was very obvious when we were doing this study is that, when you look at the available public platforms that NHIF has, you don't find information about all those sets of information that we are just discussing now, from how much money they are collecting, and how much of that is being paid out for the benefits of the services that the health facilities are providing. So generally, I think there were challenges in finding any information. Remember, the perspective we took when doing this study was not one of some technical person looking for information. It was actually of just a normal Kenyan who pays some money to NHIF or gets services through their NHIF card. If they wanted to know something, will they be able to get that information? And the simple answer for us, the very first finding of the survey, of this research, was actually that this information is not available. There are little bits and pieces that you find, but we tried to spread this across a number of years. And when you look at the period of the years that we tried to cover, there was very little information about NHIF's, almost budgeting side of it. The money is coming in, the money is going out. The membership, the breakdown of the membership, that was not information that we were able to get. However, some of the other agencies that Kip spoke to had some information around NHIF. So, for example, when you look at the Kenya National Bureau of Statistics, they do an economic survey every year. So there we were able to find some information. In fact, the biggest chunk of analysis that we did in the paper was from the Kenya National Bureau of Statistics. We also found, some information in like the health sector reports that are published by the National Treasury. Again, there was some information that at least we were able to get in that sense. And also I think there was one report we found on Parliament's website for one of the years, which I think was an audit report. So the entity that is producing the information, the entity that owns the information, has nothing on their online platforms. But then there were other bits of information that we were able to find in the other agencies.
Maybe just to lobby it in, what harm does it portend when the organization that is mandated to provide this particular information does not have the information, but other entities are providing information on the same?
So let me answer that in two ways. So the first one is, when you think about just the principles that are in place, even in the Constitution, around public service, one of the requirements that is there is that in the provision of public services, government agencies and government officials have to be transparent. It's very explicit in that language. So the first thing is that NHIF fails quite miserably to start with when it comes to that first requirement. But the second requirement, which is the second big finding for us in this study, was the fact that the agencies I've spoken to, KNBS, the Kenya National Bureau of Statistics, the Ministry of Health, the National Treasury, and Parliament, the information that they had, even for one particular year, that was available, was provided by all the agencies. One interesting thing we found is that the information sometimes was contradicting. So one says the number of mothers that delivered in a particular year under the Linda Mama program, for example, was X. The next agency, and that was for 2018-2019, the next agency has the same information around Linda Mama, but the numbers are different, right? So when the owner of the information does not take the responsibility of providing the true picture of what the situation is with the services they are providing and with the resources they are spending to provide those services, then the net effect is you have all this contradicting information. But all of them, at the bottom of the information they provide, they say the source is NHIF. So everyone says the source is NHIF, but they have numbers that are different. And so that was also a key finding for us, which was a bit concerning. Because for any of us, especially for those of us who work in the non-state side, when we want to engage with NHIF, which number do we go with? Right? If you want to engage with Parliament and we say we need more money for Linda Mama because the number of mothers visiting health facilities has increased, which number do we use? Do we use the one that says 800,000? Do we use the one that says 1 million? Right? So it makes everything difficult, even at the policy level, when we are trying to make decisions on these services.
Thanks, John. We've highlighted things to do with the transparency and the publishing of information on the sites provided by NHIF. Of places where these information, maybe where we could find the information NHIF had, what were the discrepancies in terms of the information?
Thanks, Irene. So also another discrepancy that we were able to find was disaggregation. So the disaggregation of the information that was provided from the information that we were able to find was varying. For example, so you could find the information that was published by the Parliament, which is the report from the Auditor General, the financial statement or the annual. So that report provided about 11 disaggregation for the payouts or our NHIF pays out the beneficiaries, and also the information that is paid to the health facilities and all that, or payouts. When you see in another report, which is a sector report, which is found in the National Treasury website, it also adds less, or that's 7 disaggregation for the same payouts. When you go to the KNBS reports, which is the economic surveys, they only provided 2. They only provided that is what they pay, and also maybe the national, from the national level, and also the other sources. Meaning the disaggregation was really a challenge, and you can't really analyze that information. But if NHIF could have provided, because the source is the whole quote source as NHIF, and if NHIF could have provided, especially in their financial statement or annual report, we could have found all the disaggregations. Which also you realize NHIF has 74 schemes, because according to the report from the sector report from health. So they indicate that they have 74 schemes, but only they are able to report very, very few. Meaning you can only find few, and as other agencies are reporting, they are not able to report all the information that was sourcing from NHIF.
We mentioned that we, as part of the research, we also worked with counties. So what are some of the discrepancies, inaccuracies that we were able to scope them in the county level?
Thanks. So I think that the premise of why we looked at the counties is, so health is heavily devolved. And over, I think, in the last count, about 94% of all health facilities that are under the public sector are dispensaries and health centers. Now, if you add the sub-county hospitals and you add the former provincial hospitals that we call level 5s, then almost 99% of health facilities are run by counties. NHIF has contracts with those facilities, but those facilities are managed by counties. So it means that even as we look at the NHIF at the national level, we also want to look at whether health facilities and the county budgets are reflecting how much money is coming in from NHIF. So that was the premise by which we looked at the 5 counties that Kip has mentioned. Now, the first thing that you notice is there's no standard approach to how county budgets are capturing information about the monies that are coming in from NHIF. Remember, the money is coming in from NHIF is the claims. So when you go to hospital with your card, you're provided a service, that health facility has to write a claim to NHIF, and then NHIF reimburses them for the service they've provided you. Number 2, there's money going for the poor households. So whether it's orphans, whether it's people with severe disabilities, whether it's specific programs like Linda Mama or the one for the secondary school kids, the Eduafia one. So you expect when you look at the county budgets that you will be able to see that as a county, we think that we will get X amount of money from NHIF in the coming year. Remember, this is also informed by history because we've been providing these services before. So we can almost tell every year we treat 30,000 cases of malaria. Every year we see 300,000 mothers for prenatal care and the like. So there's a way that when you're doing your budgets, you can estimate this. Now, when you look at the budgets, and also when you look at the implementation reports at the end of the year, we found that counties present this information in very different ways. There are some that will have a line called health fees or hospital fees. Now, somewhere in there, during the interviews, they will say the NHIF money is somewhere within that line. So you don't know how much of that is NHIF money, how much is money that was actually collected at the health facility. So it was very difficult to tell. For others, they had a line where they will say, this is the money coming in for NHIF. For others, it was more specific to, there are 2 facilities that did not get the NHIF money and we are angry about it. So it's in the implementation report. And they say there are 4 facilities that had made claims, but the money did not come in. So they were not able to provide the services as they should have. So there's a bit of a challenge which I think a conversation, the intergovernmental mechanisms that might be there between NHIF, the Ministry of Health, and the counties to decide that we need to have a more open way of presenting information so that even for us in the counties or for those of us who are getting services from facilities that are managed by counties, it's clear to us that money is actually coming into the health facilities and the excuse of money from NHIF has not come. Then it can be clearly canvassed at that point because we can tell whether it's coming or it's not coming. So I think the structure of the county budgets can definitely be an area where some of that information is lost.
Okay. So John has mentioned something about the interconnectedness between the national government and the health facilities at the county level. And from what he mentioned, there are some communication gaps that are emerging out. So maybe in the course of the research, what are some of the mismatches that we found in regards to communication between the national government and the county government?
Thank you. Yes. So one of the challenges that counties are facing in communication side was, for example, when they make claims that, especially for Linda Mama, so they were not able to clearly, they might not be reimbursed and they are not given such information why maybe certain changes have been made. For instance, so in Baringo, so they make claims, but they don't get the information that certain maybe there was certain changes that were made in the due course by NHIF, but they couldn't tell counties on time that this is what we cover, or this is not what we cover. For example, so NHIF covers. So initially they were covering five like clinics. So we have pre and we have also delivery time and we have postnatal. So they are not clear on what they cover, and if that passes, then they will not be reimbursed on the claims that they have made. That was one of the challenges that they faced, and also maybe the time also that they take to be able to do that. For instance, NHIF has regional or like the offices, the physical offices across most of the regions in Kenya. I think there are about 63, and counties have not been able to utilize that because we also realize all the facilities, as health facilities, as John have said, are under counties. And so counties, NHIF is bypassing counties, or they are not going through counties, which all the facilities that are in Kenya are managed, or the lower level facilities are managed by counties. And if you do that, then you get that challenge. Especially, you realize all the budgets are done by counties, and NHIF should be able to clearly go through counties so that they can be able to get what the lower level facilities are doing. I think that challenge was really affecting the side of Linda Mama. And also, when you see a Dwafia, still the same case, that counties are not aware of how they can be reimbursed about that, because there is no clear framework. But also, you realize in 2016, I think the government came up with, there was a policy for implementers on Linda Mama, which has certain information, but still there are also challenges with the same, or now counties are able to implement that.
But just to put into perspective what Kip is saying, there's a particular county where we could see like discrepancies in terms of the programs, maybe under the Linda Afya, Linda Mama, where maybe these counties were supposed to give like 5 antenatal clinics, but only, let's say, like 2. NHIF says they cover only 2. So maybe just to put it into perspective so that people can understand what these discrepancies mean. What are some of those like case scenarios that we saw during the research?
Yep, I think, and to expound on the point that Kip just made, the problem is even more severe at the lower level facilities, so dispensaries and health centers. Remember, they are the majority, so that is not good, right? But what happened is that, and I'll give interesting scenarios. So, like when we were in conversations in Machakos with some of the health providers there that manage dispensaries and health centers, all the way to the to the level 5 at the former provincial hospitals. You would hear scenarios of where they say citizens walked in and they say, I'm here for a certain service. And the health providers are like, that's not covered by NHIF. And then the citizens say, but it was announced on TV yesterday that we should be getting this service here, right? At the local health facilities. Other scenarios were, where health facilities are to take care of, expectant mothers, and there are a certain number of visits you have to make. And in some cases, the health facilities were only able to tell that NHIF reduced the number to 3 or to 4 when they are making the claim. So the mothers have come, they've been seen many times. Then when they go to claim is when then the facilities are, no, we changed the policy, and now we are only covering 3 of them. So it's up to the health facility, to incur the costs of those that then NHIF is not going to cover. So it sounded like, when we speak to the Ministry of Health, that they are very strong, intergovernmental mechanisms that are supposed to facilitate conversation between the counties and the national government entities. So NHIF, the Ministry of Health, the National Treasury. But it sounds like that mechanism is not getting especially to the lower level facilities. And that came out as a very big challenge. When you speak to the higher level facilities, like the county facilities, the county referral, they like calling themselves referral, the county referral facilities. For them, once in a while, they will tell you we were invited to a meeting in Nairobi, but there's nobody inviting the nurse in Igula dispensary somewhere in Busia to come to Nairobi to learn about the new policy that NHIF is putting in place. So there is need for clarity about how the communication to those facilities. So is NHIF and the Ministry of Health working with the assumption that if it gets to the Minister of Health in the county, automatically it gets the health facilities. But remember, the contracts are between NHIF and the facilities, not NHIF and the counties. So NHIF also cannot completely get away with, no, that's the county's responsibility. But it sounds like there's a bit of passing around the buck when it comes to who is supposed to be making sure that the policy decisions and shifts that are happening around healthcare, and especially what is covered by NHIF, that is actually getting to those lower health facilities. So that was, there are certain, I will say, mechanisms that are in place, but it doesn't sound like they are very inclusive, especially of those lower level facilities.
We've mentioned some of the gaps that we have seen existing in terms of NHIF. And key to this research is that we were also providing some of the opportunities that the NHIF can explore. And I would want us to do it in segments. So Kip, you can just cover what does NHIF need to do as an entity.
Thank you. So one of the things that NHIF should just take advantage of is just publish what they already produce right now. For example, I know they are some reports that they submit, or we know that they submit to the parliament. For example, the annual report and financial statements, they are submitted by NHIF. And I think they should first publish those ones which they already have. And another thing is for them to ensure that there is no discrepancy in the information. If they're able to publish that, then that's the first thing that they can be able to do. Also, they also submit some information, there are some reports, the financial statements to the Office of the Auditor General, which when we were also doing the research, we didn't find we could not find any information in the Auditor General, especially we only found for 1 year in Parliament. And for others, they have not provided yet. They are touted that all the other state corporations except NHIF. So we couldn't tell. But I think that's also something that NHIF should be able to also publish, that the financial statements, which we know also they do produce. Also, they should utilize their platforms. So we know they have a very good website, which they can just publish, or they can provide information. For example, they have a section on Linda Mama, but that's limited information. I think that's also where they can be able to provide at least some information on all their schemes. For example, if it's Linda Mama, and we have seen other countries that have done that. So we have Philippines, which have a section, have a report, which also when you go to their website, you can be able to find more information on payouts. You have revenues that they are able to get. They provide in their website, which NHIF can be able to borrow. Also, when I mentioned about the annual reports, which when you see just the National Social Security Fund, which is NSF, they also publish their annual reports in their website. But NHIF doesn't provide that, or has not published even a single one. But when you just compare with NSF, which has all their reports for the last about 10 years, they have constantly published. And these two institutions are just almost similar. And that's almost same work. And that's something that they should also be able to do, or publish those reports, and also utilize their, since we have the regional hubs, so regional offices for NHIF, they should be able to utilize those spaces, especially so that can be taken place. It can be taken easily by the health facilities, which can be able to reach and can be able to get that information. Because we realize also in the rural areas, they might not be able to get information easily as compared to those who are close to towns, meaning they can be able to take, or they might not be able to know how to access their website, but they can get the information through those offices, which I had said earlier that they are about 63 according to the reports that they have in each county, in most of the counties, and also they have in diploma centers. They can be able to still utilize and beef up those spaces that public can be able to get the information.
Thanks, Kip. We've mentioned something to do with NHIF as an entity, but NHIF exists under the Ministry of Health. So maybe what should the ministry do also so that they keep NHIF on check?
So the Ministry of Health is the first recipient of everything that is produced by NHIF. The Ministry of Health sits on the board of NHIF. So they are not outsiders. They are not observers of what happens in NHIF. And even not out of the goodness of their hearts, the law requires them to actually publish and publicize. Now, let me mention why I'm throwing those two words there. Publish is just what Kip has described, right? So you already produce these reports. Just put them up. Put them in your regional offices. Let the nurse in Busia be able to get to the NHIF office and say, has there anything changed? And that office can provide that information. The publicized part, which is also required, especially in our public finance laws, is that the entity is also supposed to make an effort to tell people, hey, guess what? We put information up and here is where you can get it and here is what it's about. The government is actually required to do that. Every agency that has a spending that takes up a Kenyan shilling are required to publish and publicize. So that's the first thing. So the Ministry of Health, as a recipient of these reports, as much as they pass them also to Parliament, they have a responsibility of making sure that everything they get is actually made public. Because remember, the Ministry of Health is also in charge of policy. When we spoke to the guys at NHIF, Kip can tell it was one of the nice times when we drank taxpayers' tea and ate taxpayers' mandazis. In that discussion, the language almost was NHIF is a manager of a policy that comes from the Ministry of Health and the National Treasury and the executive in general. We are not the ones who make certain decisions. So it sounds like there's a big responsibility for the Ministry of Health to make sure that it's very clear to NHIF, but it's also upon them to make sure that this information is made public because this information is actually available. We lost count the number of times we went for these interviews where somebody will turn their laptop and show us and say, the information you're looking for here it is. They'll turn the laptop and show us. They say, you see the number of people, and then it will be turned back. At no point was that information shared with us, despite the fact that we asked for it. But what that showed us, that information is there. And the detail in it is pretty incredible. And for everyone who is working around issues to do with health, that information would be very helpful. And because all of us are trying to make sure there's a health policy that is benefiting every Kenyan, it is really in the is in the interest of the Ministry of Health to make sure that all those reports are made public. They are not just for internal use. There's a thing in Kenya about things being for internal use in government that probably we need to do away. So I will say that's the first one. The second one, this intergovernmental mechanism is really run by the Ministry of Health. They are the ones who make sure that all the departments of health across the counties, the Committee for Health in Parliament and in the Senate, that there are certain common spaces where things can be canvassed and sorted out. So it's really a big responsibility on their side to make sure those intergovernmental mechanisms are inclusive. And by inclusive, I mean that they also have all the healthcare providers, not just the managers. When you bring in the Minister of Health from the county, those are the administrative guys. But the guys who really suffer when things don't go right, it's not those pips. It is the person who is at the dispensary who, 10,000 people have that facility as their source of healthcare. And, we went to some very sad places where nurses will tell us, sometimes we don't have money, right? Remember, they are providing services. They're eligible for NHIF, but they even don't know the process of getting to it. And in some scenarios, there's been a new policy that everything has to be done biometric, right? So, number one, of course, they don't have a biometric machine there. And people are coming in, they don't have money because the language in government is at dispensary level and at health center level, you just need a card. Healthcare is free. Right. So some of those nurses were telling us of how they sometimes have to contribute among themselves to buy some painkillers. Then you are thinking NHIF has 60 billion shillings. All we need to do is to tell that nurse that this is the process of accessing that money. This is the process by which you get the biometrics and the likes. And then you don't have to struggle to figure out where the money is coming from because you are eligible and the services you're providing are eligible to get. I think that's a big responsibility of the Ministry of Health to make sure that communication up and down, right? Because also you need to get feedback from all these health centers and the dispensaries. So I would say there's a big responsibility for the Ministry of Health to make sure that there's clarity to every healthcare provider about the opportunities that are there with the NHIF programs and the benefit packages and whatever services people can get from that. I would say that's also a big significant one as well.
Thanks. Well, I think that's actually the state of health in this country. Most of the people, they'll tell you when they go to facilities, most of these things are not done as quick as they would want them to go. And they really have to go through tedious processes just to make sure that things are done. But in the course of this conversation, we also mentioned things to do with accuracy, things to do with discrepancies of information. And some of these reports, the quarterly report, the financial statements, are actually presented in Parliament. And what are some of the things that you would say that the Parliament should do as part of doing their checks on NHIF?
Thank you. So, so Parliament is is supposed to approve budget, and also is supposed to oversight, and is the one to appropriate the budget. So while they are approving the budget, they should ensure that they are checking the accuracy of this information. Also, in the same line, so we know also when they receive these reports, especially financial statements and all that, they are supposed to check whether they are in line with whether they are with what they had been approved or how it was supposed to be intended to be implemented. But we felt probably that is where there is a cap in the parliament side, and also any information that's published or that is approved in parliament is supposed to be published or is supposed to be available in their website. But what we could only find is is one report from the financial statement from what they approved or the audited report from Office of the General, and that was for 2018-2019. Yet all the other reports are supposed to be passed through this house, which is very important in approving and oversighting the budget.
Thanks, Gabe. I think at the center of all of our conversations, we always throw in the Office of the Auditor General. It's because they form a very critical entity, especially in just trying to check some of these things. So, what are some of the things that they should adopt actually in their offices when checking NHIF?
You know, we like benchmarking in this country. Sorry, government officials like benchmarking, and I would send them to the Philippines website. They don't travel there; it's on the website. If you look at the Philippines NHIF, which has a very similar characteristic to ours, is run by a board that has government. You know, it has every characteristic very similar to our NHIF. They have a very long report, annual report, that has all manner of detail that Kip was mentioning. But half of that report is audits. It has information about what the Auditor General has done for their NHIF, how he's looked, you know, they've looked at everything. And it also has like the explanations that the NHIF gave on the comments that came from the Auditor General. So as you read that report, you are seeing the Auditor General clearly, you know, playing a role in making sure that they are accountable for every coin that they've gotten from citizens, where it's been spent, who it's been spent on, and the likes. And anywhere where there are questions, then the management of NHIF responds. And that is the report that is given to the public. So you actually see this conversation between the auditor and I think for us, the Auditor General definitely has a big role to play in making sure that all state corporations are audited. I think that's the starting place. The audit law we have already requires that. I think what was most disappointing for us as we were looking at the NHIF in this study was the fact that, you know, we'll go to the Auditor General's website and we'll find, you know, 100 plus reports about state corporations. But the one missing, NHIF, we only found for 1 year, right, out of the 3 years we were looking at. So I think let's start there. Make sure you audit NHIF, right? And, you know, the importance of this is when you look at our budgets, in 2020, 2021, 28% of the total government budget was spent through state corporations. If you remove salaries, right, you can see how big of the budget is actually driven by state corporations. NHIF is one of the biggest state corporations, right? There are other smaller ones, but NHIF, KenGen, and, you know, KPLC and the likes are the biggest ones. So even in the order of prioritization, you would assume NHIF should be one of those first ones that are audited. But it also comes back to the fact that as we implement this universal health coverage, there's a big expectation that a bigger portion of what will be going to NHIF will come from government. Because as we said, we are trying to make sure also that poor households that do not have the capability to pay the 500 shillings are going to be paid for by government. So that 60 billion shillings I was talking about, right now we are covering just around 1 million people under the Pro-Poor program. If you take it to 5 million, you can see how big government spending on NHIF related cost is going to be. So even more reason why the Auditor General has to audit NHIF even more closely, but as a matter of priority. I think that's one. And the second one is to make sure that in that process, it's not just NHIF. The Auditor General has now started the citizen accountability audits, which is basically the auditor's effort to make sure that the audit process is also inclusive of observations from citizens. So it's not just them going and sampling certain places and auditing and just listening to government and looking at financial statements from government, but also that they get input from, like ourselves, civil society organizations that are doing social audits. They become part of the process. Include that also when you are auditing NHIF, because there's no Kenyan, right, who does not require health services at some point in their lives. And many of us go to public hospitals. We have a story to tell as you're auditing, so that you make sure that the picture you are getting as the Auditor General and what you take to Parliament, that you want Parliament to make some decision on, also has that citizen input as well. So the Auditor General has a big role to play, especially as we continue to adopt the universal health coverage.
Thanks, John.
policy.
I think we have covered the recommendations in some of the key offices that we think should actually have a role in ensuring that NHIF is transparent and accountable. So, Kip, for this particular episode, what is your parting shot for people who are watching us?
Yes, I would tell people that they should be able to follow what NHIF is first, especially on the financial side. They should be able to follow what services are they providing and understand more about Linda Mama. Also, at the county level, they should be able to also to ensure that they are aware of the services that counties are offering, especially on functions, so that at least they can be able to interlink with that with the functions that also national government is doing. But also, finally, I think NHI also should ensure that the service, that the roles that are mandated to do, they should be able to play that. I think that's what I can see.
For me, it's directly to government entities, especially the main ones that we know play a role around healthcare. I think there is a big benefit in making sure that all decisions they are making are in the open. The NHIF Act, which was amended early this year, has now made it mandatory for every Kenyan above 18 years to be a contributor to NHIF, right? So you want to convince people to come there, because you want to drag them there screaming, right? You want to get people there in a way that they can see the value of why this being mandatory is a good thing for them. So be clear about, how much money you are collecting, how you are spending it. And in all fairness, if you look at NHIF's payout, all they collect, how much actually goes to services, it's increased from about 43% back in 2013, 2014 to over 90% now. So much more of NHIF's money is actually going to service. That's a good thing. Why would I not want that to be public, right? So it's also for them to see the benefit to them as an entity that is playing some big role in providing healthcare, in being open and, being persuasive with Kenyans as to why they should support the universal health coverage language and the resources that we have to put in as a country, but also as individuals. And that cuts across also the other agencies. They all have a role to play in making sure the public is on board. Because even you listen to the language right now with the new government, it's more of give more, right? Pay here, pay there, increase the proportion you're paying to NHIF and the likes. You can have a much easier time convincing people that if you're being transparent about the decisions you're making. And that's what we hope that the research that we did at IBP can help show where those opportunities are, even to government. Thank you.
Thanks, John and Kip, for actually joining us for this particular episode. I think for the citizens who are getting to watch us, one thing that they are able to do is through the information that we've provided on this platform, they are also able to check what other state corporations are doing. And I think that will really go a long way in promoting the principles of transparency and accountability. So that has been it for today. You can like, share, and subscribe to our social media handles. It's IBP Kenya across all social media handles. And I think it's a wrap for us on our end, and see you in the next episode. Bye-bye.